Let's know more about cataract from the experts.
Hi, this is Dr. Tanpreet here from Guru Nanak Dev Netralaya, Jammu. Today we'll be talking about the procedure related to cataract surgery as well as the post-operative, how is the recovery period of cataract. So as we all know, cataracts, no, they are cloudy areas that form on the crystalline lens, one or both of our eyes. And normally the lens is very clear. So it helps to focus our light properly. So as cataract develops, they blur our vision and they can make it hazy and less colorful. Along with we'll have some other symptoms like troubling in driving, reading, and everyday activities. And there is only one solution, a cataract surgery. There is no other solution like no putting drops or any other kind of oral medication that can help remove cataract. So the only possible treatment is cataract surgery. So what happens during a cataract surgery day? So a day prior, what will happen is an ophthalmologist will do a complete checkup of your eyes, the condition of your eyes, the examination of retina, and he will do an A scan to know the actual power of your IOL, and he will give you some pre-operatively antibiotic drops to prevent any no surgery related infections. So on the day of cataract surgery, the patient will be called early morning and he'll be instilled some dilating drops as well as some local anesthesia drops, which will help in anesthetizing the eye. And nowadays, the main procedure for cataract surgery is usually phacoemulsification. There are other procedures like extra capsule cataract surgery or a manual small incision cataract surgery, but routinely nowadays, most of the ophthalmologists they do phacoemulsification surgery. So during cataract surgery, your ophthalmologist will ask you to focus on the light of the operating microscope. Usually, no injections are given. The patient is very much awake, but he won't know that what actually is happening in his eye. He will just feel that something is entering and exiting his eye. So the surgeon, through a very small incision, like 2.2 millimeter incision or a 2.8 millimeter incision, he enters the eye, and through an ultrasound guided probe, he just emulsifies the nucleus, and then he will clear up the lens matter, and he will implant an IOL in the back. Now, this IOL, it's a kind of permanent implant which stays with the patient throughout his life. There may be different types of IOL like monofocal IOLs, a multifocal IOL, or an EDOF IOL. And the surgeon usually discusses with the patient the pros and cons of different type of IOLs. And the surgery usually lasts for around 8 to 10 minutes. And the following after surgery, the patient may be patched for close to 4 hours. It's a surgeon preference. Some surgeon patch it, some patient directly. A surgeon directly send the patient to their homes without any patch. The patient is usually, it's a daycare procedure. The patient is usually monitored for half an hour and then the patient is sent back home. And the patient is called usually the next day prior, or the patient is usually examined by the surgeon after 4 to 6 hours. And the surgeon usually advises some kind of anti-inflammatory antibiotic as well as lubricant drops, which may have to be instilled in the eyes for close to 4 to 6 weeks. And the most common symptoms which the patient feel following cataract surgery, like grittiness, watering, and foreign body sensation, a kind of mild pain in his eyes for a few days. Now, these may last from 7 to 10 days. And the vision, it may be blurry in the initial stages. It won't be like because of some inflammation, but slowly and steadily over a period of 7 to 10 days, the patient may regain his vision. And some of the post-op instructions which may be given to the patient is to avoid lifting heavy weights, to avoid splashing the eyes with water, to avoid going into the sunlight, or to avoid some dust and dirt, so that proper wound healing takes properly, as well as the risk of the post-operative complications as well as infections are reduced. So the complete healing process takes from around 3 to 4 weeks, and the patient can slowly and steadily start with his routine activities like reading, writing, watching TV after a week. around 99% of the patients there, they can get back to their work by the end of 10 days. So the success ratio of the cataract surgery is pretty high. People shouldn't be scared of getting operated. Whenever the doctor advises the patient for any cataract surgery, patient shouldn't delay the progression of cataract and get operated whenever he is advised accordingly. So with this, I wish best of luck for good luck for all the patients who are having cataract and who plan to undergo cataract surgery. So nothing to be scared of. So with the best of the technologies which are available nowadays, we can give an excellent vision to our patients as per their requirements. So thank you all. Thanks a lot.
Act early, prevent early, driving change to defeat cataract.